It is a great satisfaction to greet you, and I hope you find yourself well, both you and your pet. In today's video we will talk about the following. Can dogs have autism? Let's find out now. While some of these behaviors are unique to humans, researchers have found that autism can indeed occur in dogs, but it is called dysfunctional canine behavior. The cause is unknown. It appears to be congenital, so a dog is born with it. Studies suggest that dogs with this disorder lack neurons called mirror neurons, as they help puppies and young dogs to mirror the behaviors of older dogs in social situations. Without these mirror neurons, a dog cannot develop these social skills, just like humans with autism. 1. Conditions in dogs that resemble autism. Aside from canine behavior disorder, there are other disorders in dogs that can produce clinical signs similar to autism in people. These are as follows. Canine anxiety. Dogs with this condition may exhibit compulsive behaviors such as compulsive chewing or turning, hypersensitivity to sound and touch, seeking familiar surroundings, and avoiding play or eye contact. Intracranial neurological disease such as brain tumors or encephalitis. Dogs with these conditions can have abnormal episodes of staring or circling and have even been reported to have obsessive chewing behaviors. Canine hypothyroidism. Dogs with this condition can be severely lethargic, which can make them appear distant or lazy. However, and in general, this behavior is not related to compulsive activities. Discuss your dog's behavior with your vet if you are concerned that he may have autism or any of the disorders I just told you about. Your vet may recommend some behavioral tests, blood tests, and possibly advanced brain imaging, such as an MRI or CT scan. 2. Autism in humans versus autism in dogs. It can be difficult to diagnose autism in dogs due to a lack of evidence, but clinical signs can make veterinarians suspicious of dysfunctional canine behavior. Autism in dogs does not have a spectrum like human autism, so veterinarians are confident in comparing normal versus abnormal behavior. Dogs that demonstrate repetitive and compulsive behaviors, along with low social interaction, can make veterinarians suspect this diagnosis, although they will rule out other medical and behavioral conditions before a final diagnosis. 3. Signs of autism in dogs. Antisocial behavior. If your dog doesn't pay attention to you during walks, playtime, or mealtime, or if your dog doesn't want to interact with other dogs. Obsessive-compulsive behaviors. These can be movements such as obsessively circling, tail chasing, chewing or teeth grinding. There are even reports of dogs lining up their toys or other objects. Communication problems. Dogs with possible autism may not be able to express their feelings or moods as easily as other dogs. For example, they may not wag their tails when they are happy, or they may not put their ears back when held back. They can also stare into space for a long time. They can be calmer than other dogs, appear to lack personality, or avoid eye contact with humans and other dogs. Inappropriate reaction to stimuli. For example, you might scream when touched gently. It can be oversensitive to a stimulus as gentle as stroking its head, which can lead to pain, aggression, or fear. You can also be hypersensitive to noise, especially sudden sounds. Avoid new environments and situations. These dogs are removed to a familiar and safe space, like a closet or under a bed, to avoid new stimuli. Lethargy and decreased physical activity. These dogs may lose interest and avoid high-energy activities, such as playtime with humans and other dogs. Treatment. There is no single treatment. After ruling out other possible medical conditions and making a true diagnosis, your vet may recommend some therapies such as medicines. Certain medications can relieve compulsive disorders. Fluoxetine, Prozac, and other behavior-modifying medications may be helpful. Calming medications and sedatives can also help. Don't force situations that can cause stress. Regular exercise. Regular and consistent exercise can help reduce anxiety and stress while keeping your dog's mind busy. Positive reinforcement. Working with your veterinarian, trained trainers, and certified veterinary behaviorists can be helpful in managing dysfunctional canine behavior. Would you like to have more professional information, and especially updated about your dog? Visit the website below in the description of this video. Do not stop subscribing to the channel, comment, and share the video. You are very well, thank you.